Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith and I'm here today with Meaghan Sharp. And Meaghan, you are our Interim Chief Nursing Executive, and this is Nurses Week. So you are a nurse, obviously. Nursing is a calling. I don't know a lot about nursing, but I do know that. And I also know that it's a very demanding job. Why do people choose to become nurses?
I think, as you had mentioned, it is a calling, but I think there's something inherent in majority of us as nurses. It's that calling to care for individuals, that empathetic soul that we have to make a difference in the lives of people that we choose to care for. I think nursing is also such a variety of areas that you can practice in today's world of nursing. From administration to point of care to public health. There's so many options that if you're considering nursing, it's a wonderful career. And I think the important thing over the years, my 20 plus years now in some forms of nursing, is the ability to shape memories. The ability to have people come back to you and thank you, saying, thank you for the care you provided my father. An example I had many years ago when I was an ER nurse, I happened to be out and about in the community, and when you're in the ER in particular, you don't necessarily remember everybody's faces because so many people are coming through the door that need your support and care. That she came up to me and said, I just want to thank you for caring for my father. So at that moment, I remembered that I shaped someone's life in caring for her father, who was obviously very important to her. So the ability that we have to shape memories, sometimes they're not great memories, but majority of the time, I think nurses were able to shape great memories for families and their loved ones. So
it's extraordinary, those types of experiences, and it takes a very unique type of person to have the strength and the knowledge and the fortitude to be a nurse. How is nursing a unique profession from any other?
I think in terms of what I just said earlier too, it's the ability that we have the opportunity to go many places. We can go across the world and nurse. We can look at any other opportunity in nursing in terms of point of care, public health, administration, many areas, academics. It's such a variety of work. It's unique because I think in terms of in our world, in acute care, we're there 24/7. We're there, we're seeing every aspect of that patient from, in the morning until they go to bed. We're actually there seeing the relationships they have with their, care partners and their families. And it's just something that we become their family because we're there holding their hands through good times in the birth of a child or to times where it's end of life care and we're there holding the hand with that patient and the family and offering that support. So you're right, it takes a lot, it's a pillar of strength to go from, exuberance of enjoyment and getting somebody and saving their lives and being part of that team to also then, supporting somebody in the days of, before patients are passing away. I think also we have the opportunity to work collaboratively with many other health professions and, including medicine, occupational therapy, physiotherapy, etc., that we learn from each other. And I think that also brings the uniqueness with nursing too, is that we have that holistic look at the patient, being with them 24/7, that we support our other health professions that aren't with the patient as much. So.
Does that change in a situation like this one that we're in now? Obviously, the COVID-19 pandemic, people are learning new things every single day. We're pivoting all the time. How is it different for nursing in this environment versus any other day?
And it's interesting, the World Health Organization actually proclaimed this year to be the year of the nurse. And this was before, year of the nurse and the midwife. And this was before this global pandemic. And the reason why they chose that was because the commitment that nurses have in the healthcare system, but also the risk that they take every day, because there is a nursing shortage in the world. And so they've recognized that nurses have stepped up to the plate, even in these crises of shortages. And even now, I think the strength of what I've seen, in particular in acute care and in the community and across the world, that we've stepped up and that strength is coming out even more. Our skills in terms of how we, our duty to protect and support and care for our patients has shined through even more. We didn't ask for this, but our calling is to be there to support our patients. There's those, depictions that are going across social media around, the superheroes such as Superman and Spider-Man, and it gets to me every time when they're bowing down for nurses. And the depiction also shows, you could see that it's also physicians as well and other healthcare providers. But for me as a nurse, it's me picturing walking in that shroud, going to battle, and the battles against this virus. And it's very touching for me as a nurse to recognize the community thanking nurses in particular for what they're doing through this pandemic. And I'm just in awe of what this hospital has done and our nurses have done to step up to the plate, in particular in the areas where there is less control, such as our nurses that are, the ER, the ICU, and particularly our COVID unit. So the nurses on 3A, and working closely with one of my hats through this whole pandemic, watching them and seeing the anxiety and fear on their faces, but knowing that this is what they're supposed to do, knowing that this is their calling and they are there to support these patients, even if that means jeopardizing something, jeopardizing their health, jeopardizing their relationships outside of this hospital. So right now, Nursing Week, we always recognize it. It's always recognizing the commitment that nurses have made and the voice that they have in the healthcare system. But even more, we need to be saying congratulations than ever and thanking for the dedication that they're doing, regardless in acute care or public health, post-acute, long-term care. It is phenomenal work, and we can't say thank you enough.
Oh, I couldn't agree more. So what is your message to nurses during Nursing Week?
So as the Chief Nursing Executive, I just want to say again, thank you on behalf of Thunder Bay Regional Health Sciences Center for your dedication. Also, pre-COVID and during this pandemic, your strength is applaudable, and your willingness to do what it takes to support our patients and each other. The message that we also want to say is make sure that you're taking care of yourself. We also wanted to particularly send out a personal message last week and this week to our graduate nurses. We have 91 nurses that we're welcoming over the next couple of weeks that have graduated, and what a time to graduate. So we wanted to make sure that we recognize these individuals that are stepping into the world of nursing for the first time professionally outside of the academic wall, and what that must be like. So it's okay to be excited and it's okay to be fearful, but we really wanted to point in, even for graduate nurses and nurses that have been with us for a long time, that they're taking care of themselves, making sure they're eating healthy, making sure they're taking time to regroup and refresh and spend times as best you can virtually with your loved ones if you can't do that, and friends, because we know that support is so important. But I'm just in awe of you all. There's just so many dedicated nurses, and that's just not registered nurses, registered practical nurses, our unit care aides, and also our nurse practitioners that are really stepping up to the plate to support every patient and each other that during this crazy time right now through this pandemic.
You're making me choke up. Thank you. Thank you so much for everything you are doing. Thank you to all of our nurses here in our hospital, everywhere in our community. Happy Nurses Week to you. Happy Nurses Week to all of the nurses in our community. Thank you, and we'll see you soon.